All right, perfect. Welcome back.
Thanks. Thanks for
Glad you
having
could
me.
join us. Glad you're allowed to do a follow-up episode.
Yeah, look, I got some feedback, some good and bad feedback. As I said before, the first feedback was that I needed a haircut. The second feedback was that I needed a shave. So after taking care of those things, I'm just got to
Perfect.
make sure that I don't offend anyone in this session. I think the
Awesome.
main concern was that I shared a bit much about my role in breastfeeding.
Look, to be honest, the feedback that I got was pretty positive in that regards too. I think the whole point of sitting down and chatting was essentially trying to do that with someone that I trust to give us a very real kind of insight into what to expect. And I guess the issue is a lot of the time it's, you want to be careful how personal you do get, but at the same time too, like, if no one ever tells you like these are things that you have to deal with, like from my perspective, like how am I ever going to know, right?
I guess the other feedback I got is to I didn't give a very balanced approach. I think I was trying to give you the reality of what to look out for, I guess, like the traps and things.
Yeah.
But maybe what I failed to communicate is the absolute privilege it is to be a parent, obviously, for those that are. And, I think there's obviously so many joys, but I think everyone kind of knows that. So maybe that's why I got stuck into some of the things to look out for.
Yeah.
Certainly, really, it's such a delightful experience, a very massive privilege. And I think maybe if I did not communicate that in the last session, I better start with that today. So,
Um, and I think I kind of put that in the headlines and the blurb for the first episode too, right? Was you're probably the most technically qualified parent I've ever sat down with, but I guess like the crowning on the jewel qualification is that you do have, a 2-year-old daughter now, right? So, yeah, and that's kind of a lot of what we talked about too as well, is that you can kind of have all that clinical information and that background and read all the books and watch all the YouTube videos, but until you actually have the child, like anything, right? Until it's kind of a reality, it's kind of just taking it all with a grain of salt, right?
yeah, completely. Yeah, and as we discussed last week, I guess it's about kind of getting to know your own kid and what their needs are, because they're all different. They're all unique little people. Yeah, so I think being a bit adaptive with all that information you read and kind of maybe a little bit of trial and error within safety,
Yeah.
and and I think taking on board, being open to advice, and taking what works for you, and maybe setting aside what doesn't, is kind of to me what it's all about. Yeah.
Yeah, I think that can be kind of broadly placed on any topic, right? Not even just specifically parenting, but
Completely. Yeah. Yeah.
okay, cool. So, I mean, look, last time we sat down and chat, we got a lot of that sort of more personal sort of side of things, which I really appreciated. But I noticed when I went back and listened, a lot of the things that we were like, oh, we'll come back to that or we'll circle around to that, tended to be probably more of like that clinical discussion. So kind of be drawing more on, I guess, like your official qualifications.
Okay.
Which I don't know if we intended to do that or if that's just the way that it worked out, but I think that worked out pretty well in the end. So just a few of the topics that I've got here, some of the things that we really touched on. Probably the first one I want to have a little chat about is post-natal depression, and I think particularly how it affects men. And I always feel like I need to preface these conversations with, like, if anyone's listening, like, please don't take like offense to anything I say if I like misconstrue or say it incorrectly. But I think personally, my own kind of understanding of postnatal depression, I guess I always just assumed that it had a lot to do with hormonal fluctuations in terms of being pregnant, going through pregnancy, what that means, and then I guess coming out on the other side, and spending a little time letting things readjust. But to hear that then there's an applicable part of the population that are men that suffer from a little bit of postnatal depression, I guess kind of caught me offside and probably disproves that original assumption that I had, right?
Well,
Yeah.
I think your assumptions are correct. There's different theories as to why women experience such high rates of postnatal depression. And, my last reading was about 9 to 10% of women do experiencing it some course of their either pregnancy or postnatally within the 12 months after they deliver their child. And certainly one of the leading hypotheses is that it can be due to the massive hormonal shifts that are occurring. And similar to some of the dynamic things that we discussed last week affecting fathers. There's massive changes in relationship dynamics, in the literal requirements of what the mother's called to do, sleep deprivation, the adjustment to having a new child, whether it's their first or second, third, fourth, and how that changes their interaction with their other children or other people in their family unit. So I think certainly your reading is correct. So I don't think that's any less correct just because we might shift our focus to men. So
Yeah. In your experience, like I've heard a lot of particularly women say, or like an element of fear that they feel like they might not have essentially that feeling of maternal instinct from like immediately like going into pregnancy. Or I know even with Kat, I think one of her concerns was that she felt like it might not be something for her that particularly came quite easy. But then definitely seeing as she's progressed kind of through the pregnancy, how her attitude has kind of shifted even towards like the dog and how she talks to the dog and cares for the dog, like over this kind of pregnancy experience. Is that something that you see much in men? Like, is there, and maybe even for yourself, is there a general fear of, what if I'm not have that paternal sort of instinct, or like, what if being a father isn't something that comes like completely naturally to me? Is that kind of wrapped up in that same sort of conversation as postnatal depression?
So I guess you've raised a couple of things there. I think like for both parties, there's strong societal expectations about the sheer joy and elation that people should experience when they become parents. And, I think that kind of becomes quite risky for some people who are less confident in what they're able to do, or, maybe they haven't experienced that bonding through the course of the pregnancy, whether it's the mum or the dad. But then the expectation of everyone around them is that they should be completely grateful, completely elated, very happy. And so I think traditionally there's been little space for people to maybe, put out there that they're maybe struggling a bit with their connection or their bond with their child. And maybe later we might define some terms like attachment and bonding so that we can put in context what we're discussing. And certainly there's not been a space for parents to say, I don't feel confident in what I'm doing, like I'm a bit apprehensive about this. I think, certainly traditionally that a lot of that pressure has been on women, and we look at traditional models of families that women are expected that, this is an essential role, but we've seen massive shifts, and I think with those shifts now it's increasingly a shared kind of expectation of fathers that they are kind of over the moon about having children and take a more active role in everything else. So I guess, look, that's a massive pressure that face men as well, certainly.
Yeah. And I guess kind of to segue in, that was the perfect way to bring it up. We did speak a lot in kind of last week's episode about definitely the attachment theory of parenting. And I guess for me, that's probably the first time I've heard that used. And I was just wondering if you could give a little background into what exactly that means. And I guess maybe an overview of, are there plenty of different styles? Like, why was it that for you in particular, like this one seemed to be the way that you guys decided you wanted to go? What kind of drew you to it?
Yeah. So I guess without hijacking your podcast, do you want to put to bed the discussion about postnatal depression in men first?
Yeah, perfect.
Yeah.
I appreciate you keeping me on task. Yeah.
Right. It kind of also keeps me on task, so I remember everything that I might want to bring up. But I kind of just mentioned before that there's actually quite high rates. We know in Australians that about 45% of Australians will experience some form of mental illness throughout the course of their life. And about 1 in 8 men will experience depression in their life as well. So within the first 12 months of a man becoming a father, there's a risk of about 3 to 5%, or a prevalence of about 3 to 5% of men who become fathers developing postnatal depression. And it actually manifests pretty much identical to a major depressive episode. There's certain things that put them at risk. So we certainly know that if there's kind of turmoil in the relationship, if the mother is also herself experiencing postnatal depression, if they don't enjoy a strong social network of people to support them through the process, if they're undergoing financial hardship, or they're unemployed, or they belong to like a lower socioeconomic class in society, or if they have pre-existing mental illness, such as a history of depression or anxiety. These are all things that increase their risk of developing a postnatal paternal depression in the first 12 months.
Mhm.
So, I think depression is often used as a bit of a colloquial term. We say, oh, I feel so depressed because I missed the train. And, this is another discussion about how some people experience that use of the word. But clinical depression is kind of characterized by a number of a constellation of symptoms, really. And so, there's different classification criteria, but certainly the one that most psychiatrists in Australia would go by kind of define depression as involving at least either a low pervasive or a pervasively low mood for most of the time, or otherwise kind of someone not deriving pleasure from their usual hobbies and interests and kind of not enjoying things that they otherwise or what they usually do.
Mhm.
And then alongside either of those, people have other symptoms. So it might affect their concentration and their memory. They might notice changes in their appetite and then their weight, either going up or down. They can experience disturbance in their sleep. And I think there is often, we're quite aware of the risk of things like suicidal ideation and thoughts, and that comes along with major depressive episodes. And also along with that, often when people are experiencing postnatal depression, either men or women, they start developing a strong sense of guilt and worthlessness, which again kind of pervades their experience of life, but also pervades their experience of being a parent. So it's always important when people start noticing this in themselves or their partner, that rather than shying away from the conversation, that we try and offer people help. The other risk is when depression in the postnatal period for men and women becomes quite severe. Sometimes it can get to the degree where there's almost some psychotic symptoms where people start having really kind of delusional beliefs about the health of their children, or they start having thoughts which are not in keeping with what they want, but they start worrying that they might harm their child, or they might actually think that their child is in some way evil. And so obviously these are things we've got to pick up on really early, because that presents a massive risk to the children and also to the people.
Yeah.
And I guess I think it's really good that, certainly as the stigma falls away from mental health in general, people are more open for these discussions, but there are elements of our community who still have quite stigmatizing views towards mental illness. And it means that members of these parts of our society probably at quite a high risk of untreated and undiagnosed mental illness, including postnatal depression. I guess the consequences, obviously we talk about, if we don't pick this up, there's a risk that the father, we'll just focus on the father, I guess, for the purpose of this. Yeah. The father may experience unnecessary suffering through what might otherwise be a really important period for them. Also, as we'll learn, there's significant consequences for the bond. So that's describing the relationship and the feelings and the emotion that the father experiences towards his child. And also there's consequences for the attachment that the child develops towards the father during that period as well. Yeah. Obviously, when you have a depressed partner, there's significant consequences for the mother, or if it's a same-sex partnership, then the other father. So that also increases the partner's risk of developing postnatal depression as well. And really, probably finally, the other thing is, another feature, as we mentioned before, is obviously with untreated depression, there is a potential risk in people who experience suicidal thoughts that they may actually go on to harm themselves or commit suicide. Yeah. So I think there's significant consequences of missing this. I kind of probably segued I got a bit lost there, but basically, it's really fantastic. We're picking up more and more women through proactive screening, both in the obstetrics units, but also with maternal health nurses visiting families. And I think, and I hope, and I believe that we're also starting to ask men more increasingly whether or not they're having symptoms of depression at those points of care as well. Yeah. But I would think, just like all mental illness, it still goes large. There's still a large proportion of people who are undiagnosed and unfortunately don't get the help that they might otherwise. Yeah. So I just talked a lot. I just kind of dumped that. I guess I wanted to define what postnatal depression is. Yeah. I guess the other thing is sometimes there's things that masquerade or look a little bit like depression, especially in the early period of, shortly after the birth of the child. So, one thing that is very hard to distinguish sometimes is severe sleep deprivation.
And I guess that was going to be the follow-up question, right? Is where does your kind of lull in mood or how you kind of able to kind of get on with your day really just reflect the fact that you're waking every 2.5 hours for the last like 3 or 4 weeks, right?
Well, look, I don't have a lot of experience in diagnosing this myself because I haven't worked in perinatal psychiatry. I think obviously the way that you go about making that differentiation is the constellation or the collection of symptoms someone is experiencing. So, you might think if it's sleep deprivation, that might be more limited to kind of low energy, which can be a feature of depression. And they might not have that kind of anhedonia or the lack of interest in pleasurable activities that they might otherwise have if they're depressed. Also, what you do is you try and remedy their sleep deprivation by providing more support. And if the mood lifts and everything else improves, then it makes it a bit easier to differentiate as well.
Yeah.
I think the other thing is obviously a known entity in women is certainly what do they call it? The baby blues. So that's kind of like another thing that looks near identical to depression, but you don't need all the same number of symptoms to make it up. The main difference there lies in that usually it's self-resolving and kind of within 2 weeks the symptoms kind of go away once everything settles down. Whereas a postnatal depressive episode will, by virtue of the definition, basically states that they have to have had those symptoms for a minimum of 2 weeks that are enduring and ongoing after that time. So I guess it's all about severity, reversibility, duration, and the number of symptoms which make the diagnosis, if that makes sense.
Yeah, for sure. And this is kind of, I guess, to follow on from a conversation that I had with Kieran last week, and how good it is that we're starting to talk more about mental health, and that people that are suffering from, some issues with mental health feel more and more like they can reach out. But I guess the question is then that the other side of the coin is, if someone does reach out to you and does say that this is something that they're struggling with, other than kind of encouraging them to seek help and letting them know that it's, not a situation that's unique to them, is there anything else that you can do? I mean, obviously different depending on, your background and experience with, but for someone like myself, other than kind of point them in a direction to someone that can help them and just be a little bit more reassuring, is there kind of anything else that we can do to help?
Hold that thought. I can't hear you over my heater, so I'm just going to turn it down. Hold on.
Yeah.
Okay, so I think the main thing is just listening and trying not to interrupt when people are telling you these things. I think the other thing is trying not to be uncomfortable. That person's obviously communicating to you that they feel comfortable in telling you. So really all they're asking you to do is listen initially. But they're also really offering you a point of entry for you to make some recommendations once you've heard them out. I think the main thing is, like you said, is kind of normalizing a little bit. So saying, yeah, look, my understanding is that particularly say following the birth of a child, that it's quite common for men to experience significant adjustments that might put them at risk of developing things like depression. It's so common in women. We recognize it's common in men as well. And there's no shame in seeking help. And actually, as a father, you have a bit of a responsibility to seek help and make sure that you're functioning optimally to support your child and your partner. So I think just kind of trying to normalize it a little bit is important. I think as well as saying, maybe they're saying to you that they're having trouble taking responsibility. So as well as saying you should go see your GP or, you should talk to someone about it, maybe offering to assist them with either of those things, saying, look, is this a conversation you want me to be around when you have it with your partner, your mum, your family?
Come on a podcast.
What's that? Oh, on my podcast. Yeah, come on. Self-disclosures. Or saying like, it's really hard and it's a bit of an unknown, but like, I'm totally happy and available to go with you to a GP. If you don't already have one, maybe I can find out some names of good ones and we can go together. I can either just come with you or, I can come in with you as well. Because I guess by opening up to you, that person is giving you an invitation to try and help them, I guess. So I think the main thing is not to, you can even, I think the other thing is to say, oh, look, this is something I haven't faced if it's not. being really open that it's something new for you, so you don't have to pretend like you feel totally comfortable with dealing with it. Letting them know you're there and that you're happy to give them practical assistance, so attending things as well as just directing them. Yeah, I think those are probably important things to do.
Yeah. I think that I can sort of understand, and especially as we continue to bring up the terms like attachment and bond like that, that I think generally speaking, we all want to be liked, and we all want to be loved and feel like we kind of fit in with the tribe. And I can imagine that there is an element of pressure that comes with like, hope the baby likes me, because, there's, because if it doesn't, it's going to make things, much more difficult. And I guess that's one of the things that I kind of want to stem towards is, things that you can do to work to try to increase the feelings of bond, that attachment. I think particularly last week you mentioned that, in the early stages, you felt a little bit like you were not like on the sideline, but kind of to the side a little bit. And it was very much like mum and baby orientated. So yeah, I guess that's kind of where, my feelings would be that like, that would be something quite hard to, not quite hard, I'm trying to find the right words, but something that I might be a little bit apprehensive about, right? Is that, what if it's not this, like, here's your baby and it's this like immediate like feeling, you know what I mean?
Yeah. So I guess, we talked about last week how, probably for the first 6 to 12 months of the child's life, the infant doesn't see itself as an individual who autonomously functions outside of the womb. So they still see themselves as a continuation of the mum. Mm-hmm. So in a lot of ways, it does kind of, the main function often does come down to the mum, to providing the immediate things and that attachment, if she's able to do so. So I guess like, it's all about, for me, and I think for a lot of guys, and we talked about last time about finding roles where we can take ownership of something that is the assistance either directly to the infant, the newborn infant, or directly supportive of the mother who has to have that major role in early on. So I think that's one way of saying, okay, well, clearly I don't have the physiological tools to provide breastfeeding, but what role can I have in that process that might be useful for each of them? Or, what practical role can I take on within the household to kind of, I guess, support everyone who's now part of the family unit as well. And by seeking these roles, that kind of helps define an identity as a father, which is productive. Because I guess the other side is, if everyone else swoops in and like, you don't find a role in there, certainly your feeling of being lost is going to be exaggerated, I think. So I think the first thing is to look at roles and opportunities to support either directly or indirectly the mother and child. Again, I guess I don't want to, I know that I've got some same-sex friends who have children as well, so I'll be mindful of them. So when I say mother and father, I don't mean to discriminate against them. But I guess there's usually what we call a primary caregiver who the child initially will go to predominantly. And certainly for the first 6 to 12 months, that's usually the mother in a heterosexual relationship. So, yeah.
Yeah. Cool.
Does that make sense? Or?
Yeah, for sure. And I think
the other thing that I think it's just really important to keep thinking about this as someone going into fatherhood for the first time, is conceptualizing some of those changes in dynamics that occur between you and your partner. Certainly when you're in a 2-person relationship, each of you is in the forefront of mind of the other. But once you bring in a child, it's kind of natural that, say the mother, like her ability to attend to the needs of a new baby and the needs she previously attended to for her partner are diminished, obviously, and appropriately. So for some people, that can be quite difficult.
Yeah. So you think it's a real world changer, huh?
Oh, completely. Yeah. And I guess it depends on the level of involvement you want with your child. Sure. It might not, for some people, it might not be a big world changer. And we talked about the different roles that people take and feel comfortable with as a father. So for some people, they might actually continue on what they were doing before. If that's working 18 hours a day to provide, the financial means of supporting the family, maybe their life's not going to change so much, but hopefully they have been able to mobilize the support and assistance through their kind of tribe or their family network to fill in for those other practical things that their partner and the baby might need in shorter term. So yeah, but then I think from what you've described about your approach, or the approach you think you might want to take as a parent, I would say it's going to be a game changer, of course. Yeah. You know, I think a lot of people, I think even within my own relationship, you know, despite us both having strong beliefs in gender equality, I think in some ways we still, our domestic roles still reflect some traditional roles, I guess. You know, I'm a useless cook, so Marina tends to take charge of that. She doesn't want to eat my cooking. But certainly at some stages I've had to take some more charge of that to support her. So yeah, I think it's a bit of a change. Like the more involved you want to be, the more of a game change it's going to be as such. Yeah.
Yeah. It's funny, while you brought up food, after we talked last week about, you know, some of those roles taking on in terms of defining boundaries for family and friends and support network and stuff like that. A lot of the feedback that I got directly was tell people if they want to help, just to make sure there's food around. So a lot of like my friends who are new parents said the most helpful thing they found was like coming back from the hospital, or like even if, you know, they got time to go home and have a shower, having like either food in the fridge that was just like ready to be eaten, or like a couple of prep service meals or whatever it was like made a huge difference, was a huge help. So
yeah, definitely. I'm glad you bring that up. I think when we think about boundaries, quite often people see that as a bit of a negative term. It's kind of like saying you're not allowed to do this.
Yeah.
This is a limit of what you are allowed to do. I think the best way to communicate boundaries is about just helping people understand what you need. So, you know, we talked about trying to recognize the strengths within the people that want to support you and trying to play to their strengths. So, you know, I certainly know that your sister's going to be, and your mum as well, phenomenal at providing all that food and everything. And so really welcoming that. And I guess the other thing setting boundaries does is it allows a conversation to be had. So it allows the family to seek, I guess, direction from you about what do you need from us, and also continuing to have a conversation about, oh, what have you found useful in us supporting you? What's been less useful? And you being able to also reflect to them the same things. So I think boundaries, although they have a bit of a negative connotation, I think everyone enjoys things more, feels more confident in themselves and their relationships with everyone involved when they know what the expectations are and when there's an open lines of communication. I think that's what good boundaries do. Yeah. I think if we talk about boundaries like this is the box you're allowed to, don't step over it or there's going to be repercussions and I'm going to cut you out. Yeah. That is very unproductive. It's about trying to help people understand the roles that they can do in supporting you, and yeah, being able to communicate like, oh, we just need, you know, it'd probably be a good time for us to just have some space, the three of us. We'd love to see you, say, tomorrow, whatever it is, you know.
Yeah.
But I think just starting those conversations early, that's helpful. Yeah. Because obviously everyone's so excited and this happens. And I think, you know, people often don't know what it is that the people want from them. And that makes them more anxious. And then they're like, well, if I don't do all these things, if I'm not over there every day, are they going to think I'm not interested? I don't want to help them. I don't care about this new child. So I think it's really good to kind of set out some kind of, you know, friendly and well-meaning expectations early on.
I think the flip side of the coin too, right, is a little bit of, it might be your first time meeting the new baby and kind of, but it's definitely, you're probably definitely not the first visitor and you're probably definitely not the first visitor of the day, right?
Yeah, possibly,
yeah. Yeah, but I think that was probably the point that I got the most feedback on. Okay. Yeah, so appreciate you bringing that up.
Just to jump in, discussing boundaries is not about disciplining well-meaning family members. It's just about helping them understand what your needs are. It's also a way of communicating your appreciation for what they're offering and reducing everyone's anxieties that will likely ensue if people don't know what the expectations of them are.
Yeah.
So they're a positive thing. We've got to paint them in a positive light.
Yeah, for sure. All right. I really want to talk about attachment and bond. So,
okay. All right.
And I think probably like I'm going to ask you a few more open-ended questions just so that you can do a bit of a monologue, because I think that when you tell a story like I tell a story and you go all the way around in a circle, and I think kind of that's where we get the most value from it. So if you want to start by just sort of defining the terms, but I think more so like practically, I guess, like what that actually means and like how you can sort of put those activities or behaviors or kind of processes into place to foster and nurture, develop, encourage like attachment between like child and parent, or child and caregiver, or child and father, really.
Right. So I guess, I'm kind of someone who despises trying to memorize definitions, but I'll try and define it how I understand it and how I find it practically applicable. So, when we talk about attachment, it kind of, in the health or the psychology and psychiatry, when we talk about attachment, we talk about the emotional bond or connection that the child develops towards its primary caregivers. So primary caregivers, as we mentioned before, is usually often, obviously the parents, because they're the ones they're providing for the child, but often extends to other family members or siblings even. So it can include aunties, uncles, grandparents, or more older siblings as well in some cases. Whereas when we say bond, we are actually talking about the opposite. So that's the emotional connection and feelings evoked in a parent for their child. So obviously both of those things, it's a bi-directional relationship. So attachment from the child to the parents and bond from parents to the child. So there's different types. So when I say it talks about the nature of these connections, there's different types of attachment. So we talk about, in psychiatry and psychology, we talk about secure attachment being healthy and insecure attachment being maybe unhealthy, if you like.
Yeah, I guess attachment is sort of a term like boundaries, right? Like, I guess to me, the initial thought is potentially a negative connotation there. Like you think of like attachment issues, right?
Yeah, well, that's right. Yeah. So, there's healthy attachment is secure. And then when you have attachment issues, you have what we would talk about as an insecure attachment. And so I guess, defining what creates a secure attachment with a primary caregiver, it's kind of a relationship where the child develops a positive self-identity, or it's the building blocks for a child developing a positive self-identity. It's a relationship where the child learns to self-regulate and self-soothe appropriately. It's also a relationship, as we talked about last week, which kind of sets up these internal working models of relationships that the child will have for the rest of their life as well. And I guess the other thing is it kind of, I think a child who has a secure attachment develops a confidence in exploring its world, knowing that in the event that it needs assistance, there's always someone to come back who will shield them and protect them. So that kind of describes, in my mind, what a secure attachment is. There's different types of insecure attachment, but just broadly, they kind of describe these attachment, what did you say? Attachment
issues.
Issues, yeah. And so, children who have an insecure attachment are at higher risk of different things throughout their life course. So early on, for babies who have an insecure attachment to their mothers, they can develop a kind of be a little bit passive and withdrawn. They might have problems interacting normally with their mothers. So again, presuming that the mother's the primary care or the primary attachment figure, they might, when the mother comes into the room, they might become highly distressed or despondent, which is obviously not what you'd usually expect. And the other thing that can happen in young infants is that they can develop, or they can have developmental delays. So delays in kind of all those things like sitting up, or walking, or developing and speaking, smiling, all these kind of things may be delayed further than what is usually considered normal. Then when you go to toddlers and preschoolers who have an insecure style of attachment to their primary caregivers, you might notice that they have difficulty relating to other kids of a similar age. Again, they might have developmental delays in their language and their learning. They can also become more aggressive and destructive as well. And often they respond very poorly to when they are disciplined as well. They can't tolerate being disciplined. So that can become problematic. And I guess if we progress further, we go to school kids. So what's the problem for school kids and schoolgoers when they have an insecure attachment So their problems generally become behavioural disturbance at school. That's when you start having increased rates of mood disorders such as depression and also anxiety disorders in young children. And they also tend to perform worse off academically, and there's also higher rates of other mental illnesses like ADHD. I guess if you take it through the life course and you take the adults, which is kind of where I'm working at the interface, is we understand, and this is why psychiatrists are always so interested in people's early childhood life and their interaction with their parents and primary caregivers, is because unfortunately people who have developed an insecure attachment by often, no fault of their own, but more reflective of their parents' circumstances, mental capacities and everything else, they're at a higher risk of developing things like mental illness, substance use, interpersonal problems as a result of kind of personality dysfunction. Then that results in them experiencing kind of or missing out on vocational and educational opportunities as adults as well. So, this is something that if we can set up really early, we give our kids the best chance lifelong. So that's why I guess there's such a focus on these new styles of parenting, and also a focus on kind of mindful parenting as well, which I guess we'll go on to discuss in a moment.
Go on.
How am I going? Am I talking too much?
No, I think it's really good. I think probably the thing that I'm kind of thinking the most is like, okay, cool. What are some examples of behaviors that might encourage like insecure attachment, right? Like,
yeah. So I guess there's, maybe this feeds in well to different types of parenting, I think. Again, I guess I'm just presenting my opinion, and I think it's good to recognize that there's no gold standard way to parent children, because if there was, we'd all be doing it, just like we talked about last time. In surgery, if there's one best way of doing it, everyone does it. There's not other approach. I think the same is true of parenting. So there's different parenting philosophies around. There's kind of the old school and the new school. I think it's important that any new parent is somewhat adaptive, because even our own experience, or my own experience, is that you can take a little bit from every type of discipline or parenting philosophy for different circumstances. So yeah, I guess if we think about the old school, from my knowledge, and I got to say a lot of my knowledge about this stuff has come from Marina, my partner. I've kind of, what do you call it? I've allowed her to kind of do a lot of the research and feed it back to me. So I've been a bit
delegating. I think that's cool.
Yeah. Okay. So I've relegated a lot of it to her. So she basically describes, it's kind of, I think there's about 4 older styles of parenting. So there's the authoritarian parents, who are kind of considered the disciplinarians, where everything is quite rigid rules, where there's high expectations of the child to adhere to these rules. Communication's kind of one way from the parents to the child. It's probably that really old school of children should be seen but not heard. Yeah. And so it's about defining rules for children without maybe providing the rationale and things. That's authoritarian parenting. And they kind of talk about, I think it's permissive and kind of indulgent parenting. So it's kind of, in some ways, the opposite. It's where children are allowed to do what they want, kind of run the show a bit, but the parents are still available for them to kind of give a bit of advice, kind of set some broad limits. And there's certainly a degree of nurturing in that. The real exaggeration of that is called kind of uninvolved parenting, where the kids do whatever they want. The parents are really uninvolved and not involved, in terms of their attention. They're not paying attention. They're not responding to their kids' needs. The kids are maybe causing havoc, and the parents aren't putting some boundaries there potentially. And then I guess the middle ground is probably what I think they call authoritative. I can never say the word authoritative parenting. So that's kind of where, yes, there's clear expectations of the child. There are rules. Parents are probably a little bit more flexible, and there's still nurturing. So at least the parents will describe to the kids the rationale behind the rules. So I think they kind of describe the more traditional approaches to parenting. I think when we talk about different styles of doing things, I think when you think about authoritative and authoritarian, there's more kind of the controlled crying sort of stuff. There's also the regimented feeding times as well. I guess what I find interesting is that, certainly over the years, that from a health point of view, lots of things have changed. And I think that reflects a change in the movement of maybe not so much parenting, but our understanding of what kids' needs are early on and what the importance of attachment and bonding are. So for instance, I don't know how long ago, but I believe in the 50s and 60s, the standard practice there was as soon as your baby was delivered, it was whipped off to the nursery because the people who could provide for it best were nursing staff.
Mm-hmm.
Whereas now, obviously, there's this massive emphasis on as soon as the baby is delivered, as long as it's medically stable, it goes right onto the mum's chest or the dad's chest. So that attachment and bonding can occur straight away because we recognize the importance of that. And, that's come from animal models and studies, which now has been translated into medical practice. So, a lot of that's informed by attachment. And the other thing would be kind of like we talked about, in the past, midwives would lecture parents on kind of, you need to dictate when your child has a feed. So you're going to fuss over it if you give it whenever it wants. So it's every 4 hours. Now the approach, as I understand it, and I could be wrong, maybe it shows my ignorance despite having my own kid, is that it's kind of like you feed on demand, but if they haven't fed within 2 hours, then you need to proactively offer it. So we've come full circle on that as well. Yeah. So I think certainly medical science is being more and more informed about things from attachment models of care. And so I think that's probably why my leaning has become to attachment parenting. So maybe I should go on to define what is attachment parenting. Is this a good time?
You're getting the flow. Yeah. You're getting the flow, mate.
All right, so what is attachment parenting? So I guess the idea of attachment parenting is to kind of promote the secure attachment. And the idea is to do this by kind of being empathic, kind of being responsive, and being in close proximity with lots of bodily contact with your child early on. So that's kind of like the attachment. I guess the focus is on developing that relationship between the infant and their primary caregivers. So that's kind of attachment parenting 101 in brief. The other one, which I kind of, we like and that we kind of subscribe to, is called respectful parenting. So what respectful parenting, my understanding of their main tenets, is that we acknowledge that every single child is an individual and is different and unique in its own ways. So for that reason, each child may require a different approach to parenting. And what I like about that kind of respectful parenting is it encourages parents to be really inquisitive as to what is driving a child's behaviour. What needs do they need to be met, and why are they doing it in this particular way? And so you're constantly thinking why, instead of being like, they have to do it like this. I've done my role, now they have to do it like this. It's like, be inquisitive. What's going on? How can we resolve this in a meaningful way for the child and myself? So yeah, I guess like my model is I kind of take a little bit from everything. So we take a little bit from the attachment parenting, a little bit from the respectful parenting, and then at other times, where safety dictates that you have to be quite authoritative. You can't let your kid run out on the street just because you don't want to like put limits on them and things like that. So I think it's important to take different things which are applicable to the child, who is a unique person in themselves and may respond differently to different styles as well. So,
do you think?
For instance, if I can just whilst I remember, I think one, for us, we certainly don't subscribe to absolutely everything that's recommended in attachment parenting. So one example is in the attachment parenting model, they really encourage co-sleeping. That's something we decided not to do in the first instance, just because of our understanding of SIDS, so sudden infant death syndrome. So there's quite a lot of research saying that the risks of SIDS increases in families who co-sleep with young infants.
Co-sleep, you mean
other factors involved with that.
So, you mean with co-sleeping, you like sharing?
Oh yeah, so pull me up on talking like that. So co-sleeping is kind of instead of having a separate cot or bed for your baby, it's actually just having them sleep in the bed.
Okay.
Yeah. And so what else? So that's one thing that we differ a bit. We decide against that. And I think also for us, we recognize if we were having really poor sleep, our ability to recognize and respond to our kids' needs during the day was affected. And so for us, it was kind of necessary to set up individual sleeping areas for us and our child. So yeah, I guess what I'm trying to give is a picture where we've just drawn what we like from different models of parenting and kind of decide what is it, which of these principles that this particular model of parenting has do I identify with and are true to my values and belief about parenting, and how can I best apply them to my family and my situation.
Yeah.
And sometimes you just got to try it out and see. Sometimes, your child might respond really positively to suggestions from the type of parenting that you think you want to apply, and other times they won't respond at all, so you got to change your tune. So,
do you think that's pretty definitive based on like your personality as an individual? Like, so one of the things I've really read about parenting, which I really liked, is from Jordan Peterson in 12 Rules for Life. And he basically talks about, like, as a parent, it's basically your role just to make sure your kid's not an asshole, right? Like, don't let your kid grow up to be like someone you resent, because if you resent them, the rest of the community and the rest of society is going to resent them, and they're not going to grow up to be a good functioning person or member of society, right? And so I think for me, as like a top level approach down, that is kind of, but I think that I think that's kind of true in terms of like my own personality, like just try not to be an asshole, like try to like take on board that there's going to be different opinions and people that think differently to you, and it has very minimal impact, right?
Yeah. Look, we talked about last week how, talking about parenting style is a very, I guess, confronting conversation for parents. I think the ultimate insult is to tell someone how to parent their children. Like, that's, the typical statement is you have no right to do that.
Yeah.
I think the other part of your question was kind of like, are there certain personalities that make you follow one particular style of parenting? Is that right? So I guess, if you've got like a perfectionistic personality, or maybe you're a bit of someone who suffers from anxiety, the way that you might manage your anxiety in your own life is to have a very regimented structure for your day so that everything is predictable. And so I guess the risk is, or maybe a risk, or maybe, it works for your child, is that then the way that you manage them is very regimented. So this is what we'll be doing this time. This is when you're going to sleep. This is when you're going to have a meal. For some children, they respond really well to that. But for other children, there might, and, certainly the evidence that I've read, sometimes being that regimented fosters within them a bit of anxiety, because then their ability to adapt to changing circumstances throughout the day and whatever else involves or evolves a bit of anxiety internally in them. So, I think the other thing that we've got to recognize is it's important, if parents are really struggling trying to do one particular style, certainly attachment informed parenting and respectful parenting, like that's a hard slog. That's trying to constantly mentalize what's going through your child's brain, and adapt your approach and your response to them. That's hard work. It's a lot harder sometimes than saying, oh, this is the rules, this is how you're going to do it. If you don't like it, you can sit there and cry it out, But for other families who are maybe really struggling, particularly families, say, with twins, little support, it's really important for them to kind of have a structure which enables them to function properly.
Yeah.
If they're completely sleep deprived, if they're having such problems with their parental role that they can't develop a positive bond, so their connection to their child, then obviously they might need to adapt a very structured kind of approach to parenting. So I think the main thing is, whenever you have this conversation with people, is not to judge the style or approach that people are using, and just to recognize that it's different ways of doing it. And some of the, there's probably pros and cons of each one. And it's just about choosing what's right for you and your kid. I know I keep saying that, but I think it's really important because you do, when you go then to your first parenting group, there's going to be people with quite distant ideas of what parenting are, which won't feel right to you at all. And obviously you're not an offensive guy, but it's always easy to make the mistake of saying, oh, well, we're going to do it this way because that's what we understand to be best. But, there's different things that inform that. We just talked about people's personalities, but there's also different cultural ways of raising children as well, obviously. So,
yeah. How much, so I got two questions for you. The first question is, how much do you feel like being in psychiatry impacts like how you approach being a parent for the first? And I guess Yeah.
incredibly. You know, I remember my sister had her first kids. Again, I shouldn't share too much personal stuff on here, I guess, but you know, and my style was like, oh, you're not getting any sleep. I think you need to implement some controlled crying. You know, there's schools that do that kind of thing. And then, you know, 5 years later, I look at, oh, yeah, 5 years later, I look at having my own family. In the course of that 5 years, I've kind of gone through the majority of my psychiatry training, and all of a sudden I'm on the other end. I'm just like, you know, I think it's really important. My values is that I use these mindful parenting techniques to understand the needs of my child. I can learn the confidence of recognizing what they need and responding to it appropriately, trying to learn to be a bit more flexible in myself and all these kind of things. So I think without any doubt, I think it's been a major benefit, hopefully. But in the same way, just like anything, the more you know, the more you worry about the consequences of your behavior and your responses. So, but I think it's, like I said last time, I think the moment you start doing things mindfully and holding your child in mind before you act instinctively to something they might be doing that might be upsetting you, then you're on the right track. Like if you're thinking about how to be a good parent, you're on the right track.
Yeah. Okay, so give me some practical takeaways in terms of how to foster and nurture like that bond.
Okay.
Obviously, like, you know, time to spend like undistracted time, like with your child, active play, like all that sort of stuff for sure.
Yeah, I guess a lot of those things we talked about were probably for kids who are a bit older, like toddlers.
Yeah.
I think early on, for particularly focusing on the father, I think finding a role is going to be really important, because if you feel like you have no role in parenting, your ability to form a bond is going to be greatly diminished.
Yeah.
Again, as I mentioned before, I think that role doesn't necessarily have to be directly benefiting or interacting with the child. Often it's in supporting your partner to do that in the early stages. But that's going to, and taking on that role, that's part of your identity as a father, is this is what I do for my family. So I think early on, finding the roles, I think finding the opportunities to have that direct physical contact with your child when they're, you know, so taking every opportunity, the other primary caregiver, the mother or your other partner needs a break, you're making sure you take that with two hands quite literally, and you're holding onto the child, having them close.
Yeah.
I know early on for me, it was about trying to give my partner some space. So taking our child for an hour and a half walk where she just was kind of cuddled on my chest. I had my jacket over the top, and we're lucky enough to kind of be close to some beautiful parks. So we'd walk through there for an hour and a half. I think so. I think where you're feeling sidelined, looking for opportunities to spend with your child, and maybe where possible, having that conversation, and not using that conversation to accuse your partner or other family members of swooping in and maybe disenfranchising you of your paternal parental role, but rather just saying, look, I'm feeling like a little bit lost. How is it that I can help? Maybe like I can look after our child for half an hour each day, so that you can attend to things that you need to do for yourself as well. And in that way, you're kind of supporting the partner as well as supporting the bond and the attachment you're trying to create. So that's kind of early on. You know, I think as they get older, it's more about just having that kind of that time that you spend together, which is kind of undistracted, completely just about what you and your child are doing in that moment. And that, as I mentioned, is non-contingent on the behavior of the child through the course of the week leading up to that time that you designate. You know, I think ideally designate that time twice a day before work. If you're the main breadwinner and the provider and you know, you're having to go to work maybe before work for at least 15-20 minutes, and then after work hopefully for a bit longer, so your partner can have a break, and then again on the week, and setting out very clear time that's just for you and your child or children, doing something that's pleasurable and enjoyable for hopefully both of you, but mostly for your kid. Turning off all the other distractions, like putting your phone on silent and things like that, is going to be really important.
Yeah. I guess the takeaway too, right, is that like anything, it takes reps, right? Like it takes practice, and you need to kind of do it a few times. Because I think there's an element of, especially with your first child, right? Like you have nothing to compare the experience to, right? And I think that to expect that you will just get it, like it's like they give you the baby and all the information comes flooding in, right? But just like you said, I think like start by holding. I mean, we had friends come and visit on the weekend, and they've got a 4-month-old, which, funnily enough, is the friends that I was referring to in the podcast as like the most experienced kind of parents that I know. And I was holding the baby, and I said to Kat, "Do you want to hold?" And she goes, "No, no, no. You need the experience. Like, you need the practice, because it's literally like the first 3-month-old baby that I've really held." And I remember, like, the first couple of minutes, I was like, is this right? Like, am I doing this properly? Like, is he okay? And it's like, oh, he's not crying, so he can't be, too uncomfortable. And then, like, the kind of the more you go on, like the kind of more you sort of relax into it a little bit, right?
That's right. You develop that confidence and everything.
Yeah.
Yeah. I think the other thing is, if you want to use different analogies, I think when I used to actually train a bit more and people would seek me out for advice how to do certain exercises, my advice would be leave your ego at the door when you go to the gym. Because if you come in there thinking you got to push heavy, you're probably going to hurt yourself or break something. I think the same thing for parenting. I think you might have an idea of what kind of parent you want to be before you actually become a parent. You have to be adaptable, because that style might not suit your child. It might not suit your family. So, I think being open to listening to advice, again, you don't necessarily have to take it, but always being a bit like open to taking advice from people and taking one, but also recognizing at a certain point, 3 months, 6 months in, if you haven't found your identity as a father, having the conversation and looking for opportunities for yourself to define that identity as well. I think that will be important too. I think something else you raised maybe last week or in between is kind of about the risks of perfectionism as a parent. Many people, particularly, people that I guess I work with, are probably type A perfectionistic people, and that's served them very well throughout their professional lives in succeeding, doing everything to a high standard. Problem with parenting is that, as we mentioned, every kid's different. And just like they say in film, it's hard to work with children and animals because they're unpredictable. So the risks of being a perfectionistic parent is that it's impractical and it's impossible. There's no such thing as a perfect parent. It's all about a good enough parent. So providing the security and the responsiveness to your kids' needs, that's what makes a good parent, not doing everything perfectly. I think the risk of trying to be a perfect parent is that because it's impossible, you're bound to fail and you're going to find yourself wanting. And that's very confronting for people who have perfectionistic traits. The other major risk is that it will lead, in most cases, I would think, that there's a risk of parents who are perfectionistic having higher expectations and standards for their kids to fulfill. And that probably happens very early on. It's like, well, the other kids in our parents group, they're already walking and they're 12 months. Why aren't you on your feet yet walking? What's wrong with you? They start getting anxious. They start kind of blaming themselves or blaming their kid. That's obviously not helpful at all. So yeah, I think, and you then in that case, they're going to find their kids wanting if their kids aren't meeting their expectations. I'm the perfect parent. I've done everything exactly right, exactly by this book that I've read. Why aren't you responding perfectly? Instead of saying, well, this book's not working, let's try another one.
Yeah.
So I think that perfectionism is gonna lead to them kind of finding themselves wanting, and I think it's going to put stress on their relationship with their partner and their child as well, where other people's performance might not live up to this perfectionist expectations as such.
Yeah.
They're the main things I would think that are a bit risky about it. I think the other problem with being a perfectionist is you can be quite, what's the word? I guess insistent that the way you're doing it is right, and it means you're less amenable to adapting your approach. Because, as a perfectionist, you want things to work out. You want the known outcome by doing everything perfect. But at some point, you might have to accept that what you were doing wasn't working. It wasn't a reflection on any fault of yourself or your child. It's just not working. But if you're too invested in one particular way, I think that becomes a bit dangerous too.
How many times a day do you reckon you stop and think oh, I get it now, in terms of things that you remember from your own childhood, or maybe lessons that because I reckon even now even with our kids, the older I get, the more I'm I'm starting to understand this is potentially, the desired goal, or why my parents might have kind of taken this angle and what they were really trying to show or achieve in that. How is that just something that's going to exponentially?
I'm glad you bring this up. I think one thing in psychiatry, there's always a risk that because psychiatrists or psychologists focus on someone's experience of being a child and what their parents were like and what their relationships with their parents were like. And, you know, sure, we might recognize that as a result of that relationship, they had insecure attachment and then they developed problems later on. Rather than using that to blame their parents, I think what we need to recognize that in most cases, parents were doing at the time what they thought was in the best interest of their kids with the information and the resources that they had available to them. So certainly sometimes I'm like, oh yeah, maybe this could have been different. I think the main thing is to say, like, give your parents the benefit of the doubt. We know that the medical information from doctors, from midwives has changed drastically in the last 40 years, as we talked about before. So certainly I think now you can reflect like, oh, geez, that was a bit different to how maybe my parents did it. But I think the main thing to hold in mind is your parents were just doing what they thought was right and what they had the resources to do at the time. So it's not about blaming parents that they could have done it better. It's just saying, oh, geez, things have changed. Yeah, now this is how we might understand it. And geez, that's different, but that's just how it is.
Yeah, I guess I didn't mean that in terms of like a blame.
No, I know you didn't mean that, but I think I like outing that to everyone. And I think I out that with my patients as well when we get up to the topic of, you know, maybe things that they think their parents could have done differently when they were younger or whatever it is. So yeah. I think as long as as a parent, I think as long as you're doing things quite mindfully rather than totally instinctually, then you're pretty safe.
Yeah.
Again, it's not about doing everything perfect. It's just, you know, it comes down to just making sure, you know, those things that we talked about checklists last week. So is the child safe? Am I safe? Is there any danger or risk of me acting in a certain way? How might my child experience me chastising them now? Is that for their betterment? Will they learn from that? Or is it better that I show some patience and I absorb my frustration? So, you know, we talked about before in that secure attachment with a primary caregiver, part of the primary caregiver's role is to teach and mirror to the child how to deal with frustration, how to navigate trauma or distress, how to tolerate negative emotions, because that's ultimately, you know, one of the most beneficial things we can do for our kids is demonstrate how to deal with adversity, and in so doing, provide our kids with a template of how to be resilient. So I think maybe once or twice a day, I would think to myself, how am I doing this? Is this the best way for me, or is it just the easiest way for me to do it?
Well, I guess it sounds like it's, you know, it's quite an introspective question, right? Because it's like, well, if I'm not even really sure how I handle with trauma or like, you know, those kind of big life events, like if I'm not even sure how I deal with it, how do I know how I'm modeling it, right?
Yeah, that's right. Yeah. And it's not about bottling things up. Like sometimes there's appropriate levels of disclosure to children at different developmental stages for them that shows them that you have a willingness to talk about feelings and emotions. And obviously, you're not going to talk to your kid about severe trauma that you might have experienced in your previous life when they're 4 years old when they can't process that. But obviously, at other times, you might say, look, this isn't your fault. I've just had a bad day. I'm feeling angry. And, you know, when I'm angry, what I do to deal with that is I go and do 50 push-ups or whatever it is you might do when you're angry. So you're saying, you know, I reckon I have the ability to recognize what I'm feeling. And in recognizing it, I have meaningful and adaptive ways of dealing with it. So that might be the way that you create this language for your children.
Yeah.
I think when you have emotionally avoidant parents, you know, in the past, you know, you weren't a man if you talked about feelings or whatever it is, you know. But that kind of one thing that certainly did was it removed the possibility of men getting help when they needed it, and it also meant that these children had an idea of being a strong father as someone who didn't recognize or talk about or process emotions on a conscious level. So I think that's another thing that's probably changed a lot. I don't know if that's a bit off topic, but whatever.
No, I think like, I definitely agree with that. Like, I think even, you know, with my dad and kind of like the generation of parent that he was, like he would give you the shirt off his back, like whatever he could do. But, you know, emotionally, like it was very hard to have conversations that were, you know, of that kind of next level and not just like that proof, like, hey, you're going, yeah, good. Oh, okay, fantastic. You know? So I guess,
different era, and
yeah,
the expectations of the father were probably quite different for him. And I would presume from your description that he, obviously I know your dad quite well, I did. He probably wasn't comfortable having those conversations as a result of his own experience of being a child and the figures that he looked up to for his role models. So yeah, I guess it's about thinking about what kind of individual do we want to create. When our kid has kids, do we want them to be someone who feels more comfortable getting in touch with their feelings and appropriately disclosing them when necessary, so that our kids understand why we might be responding in a certain way to what they're doing. So I think I agree. I think that just keeping those things in mind and modeling what we would want them to model for their own kids down the track, hopefully one day. They're lucky enough to have kids too. Yeah.
I guess that's, to summarize, it's kind of like, just give your kids attention, space to like make mistakes and be encouraging, and you're basically like 95% of the way there, right?
Totally. I think you're 95% of the way if you're just like, you're being mindful about your things. Yeah. You're just instinctively telling your kid off for doing something that's inconvenient for you. You're in a bit, that's, sure, it might work in the immediate term, but it's probably not going to have long-term consequences. I think the other thing we talked about, as well as being mindful, is like trying to develop a positive relationship with your kid, because later on when they're a teenager, the discipline doesn't come through you telling them what to do. It comes through them responding to that bond and the kind of the confidence you have in one another and what they know your unspoken expectations are. I think the greater level of discipline comes through that.
Yes.
So, yeah.
Well, mate, no doubt it's a topic that we're going to continue to have many, many conversations about over the coming years.
Offline, hopefully.
I'm sure there'll be a few phone calls at 2 a.m. in the morning.
Yeah, I hope so. Got to do something useful for you.
But, mate, thank you very much. I know it's it can be difficult to get 1 hour and really do one podcast, but to have you back to do a second, I'm really grateful and I'm really appreciative of. And like I said, you've always been a wealth of knowledge as far as like being the grown up and being the adult kind of in my life, and hope that's something that never changes, mate.
Thanks a lot. You're too kind. You got to tell me these things offline so you don't make me cry.
And I appreciate you getting the haircut and having a shave. Fantastic.
No problem.
Not that I was the one that gave you that feedback from week 1.
Terrific. All right. I'll speak to you soon.
Perfect, mate. Thank you.
See ya.